Hi, I'm Dr. Anwesha Mukherjee. I'm a pediatric cardiologist and I work as a junior consultant in Narayana Superspeciality Hospital, Howrah. Well, a pediatric cardiologist means that I specialize in treating children with heart defects. Okay, now what are the congenital heart defects? Well, congenital heart defects mainly mean the diseases related with the structure and the function of the heart. And the congenital word simply means present at birth. Okay, so heart is relatively a complex structure. It has 4 chambers, 4 valves and 2 main vessels. These are the aorta and the pulmonary artery. So we can divide them into 2 broad groups, that is acyanotic heart disease and cyanotic heart disease. Acyanotic heart disease mainly consists the diseases where there are hole in the heart, like the atrial septal defect or a ventricular septal defect, or stenotic lesions such as pulmonary stenosis, aortic stenosis. And the cyanotic heart diseases are those heart diseases where the baby turns blue either at birth or during early infancy, and the most common being Tetralogy of Fallot, transposition of the great arteries, etc. So and the next question that we face is, how common are these heart defects? Well, you'll be surprised to know that these are the most common congenital anomaly and the incidence is as high as 8 per 1,000 live births. But there's nothing to be scared. Though they are more common, they are more treatable, and you'll be surprised to know that more than 85% of the heart diseases are treatable. Okay, so next we there's a topic is, why do these children have heart defects? Okay, so it can be due to any genetic causes like Down syndrome, or some maternal factors like diabetes, infections during pregnancy, maternal intake of certain drugs, or some other environmental factors. But again, it is nobody's fault. If your children is born with a heart defect, it is not the fault of the parents. Okay? Now, how do we diagnose these defects, or how do we diagnose congenital heart defects? Well, they can be diagnosed even before birth, even when the baby is in the mother's womb. So, it can be diagnosed by a very simple test called as a fetal echocardiography. Now, if your child has certain symptoms like, increased frequency of cough and cold, not able to feed properly, not gaining proper weight, and also if your baby is turning blue either at birth or in early infancy, these are the indications that your child might be suffering from any congenital heart defects. And also in that case, you need to consult a pediatrician, and obviously if there's any audible sounds in your baby's chest or any audible murmurs, in that case a pediatrician will refer you to a pediatric cardiologist. Here we have some very simple, non-invasive and harmless tests such as a echocardiography. And echocardiography can detect whether your baby is suffering from a heart disease or not. Okay, so then we can formulate a plan and obviously give you a treatment option. How are they treated? Well, many of the heart defect, like many of the small holes, okay, they do not require any treatment. They may close on their own. Otherwise, there are some other treatments like, open heart surgeries, and also certain catheter-based interventions like ASD device closure or a ventricular septal defect device closures, or any balloon valvuloplasties, stent placements, and everything is there. Okay, so the heart disease, the message is that the heart disease are treatable. The most important factors in this case is early diagnosis, timely intervention, and an ongoing follow-up. Well, there's another very important factor. A baby or a child detected to have a congenital heart defect can lead a normal life. They can even play sports, like obviously after consulting with a pediatric cardiologist. They can go to school, they can pursue their education, they can pursue their careers, they can grow up being an adult person, a normal adult person. It sounds, to wrap up, I'll just say that it sounds scary, but treatment options are available. You just need to come at the right place at the right time and get the right treatment for your child. So like timely intervention, right diagnosis, ongoing care and emotional support for the child and for the parents will definitely help to solve the problem and treat congenital heart defects. Thank you.